Ours is a typical small family, academically oriented, very technical. We are five, wife, myself, and three sons. Our second son was perhaps the brightest of the lot, very energetic, very sharp, very discerning. But somewhere in the second year, all of us went to premier institutes in India. And somewhere in the second to third year, we did not notice it, but his grades, he failed in a number of subjects. We were not aware of it, in fact. And we found that his sleep pattern was very erratic. His eating habits were very erratic. He used to play computer games for hours on end, for something like 12 hours at a stretch. Okay, we thought it's all part of growing up. It's part of the pressure that he should see a psychiatrist. So anyway, being worried about him, we did visit a psychiatrist. They spent half an hour. And the psychiatrist said, nothing to worry, everything will become all right, let him take rest, no need to, I don't see any. Perhaps in hindsight, I think lack of positive symptoms may be the reason for not diagnosing it at that stage. All his symptoms were negative. What we found subsequently was he was socially withdrawn. He would not meet anybody, talk to any of his friends. He would be shut in his room. And we got a little worried. That's when we said something is going amiss. And he was also showing signs of aggression. Not physical, but definitely it was verbal and sometimes abrupt in his behavior. So with the help of the college authorities, we hospitalized him for a period of 3 weeks with the help of a psychiatrist. He was given medicines and he became near normal, came back home. But what I would like to highlight here is, we did not realize the importance of medication, continual medication. So what happened after about 2-3 weeks, he discontinued. He said, I'm feeling okay, everything is honky-dory, I'm back to college, you don't worry. So we let it pass. We told the doctor unfortunately also was, I do not know, he did not stress on that. And after about 3 to 4 weeks, he had his first relapse. So immediately after that, we went to re-hospitalized him. This time, the diagnosis was very clear. They said he is having schizophrenia. You got to have medicines, and these medications have to be had come what may. Whether he likes it or not, it has to be given to him. And that's when we started administering the medicine. His symptoms, he became asymptomatic, as they say, and we started reading about this disease. Honestly, we were shattered because as a family, we were never exposed to this aspect of the disease. So initially we thought, okay, it's a passing phase. But only after the second hospitalization, we started reading about it. We got sensitized to this particular disease and how we should handle it, what are the problems, and what is the way forward. But whatever little we learned, of course, the psychiatrist educated us a lot. We spent a lot of time. We went in for regular sessions with the psychiatrist for counseling. Anyway, to cut a long story short, he cleared something like 16 subjects in the last year of his college with medication, got his degree, got a job. Everything is fine. Now this is where the second stage of it. We decided, he got a job in Hyderabad. We said, okay, let him go there. on a weekly basis we will monitor his medication. Everything was fine, but after about 8 or 9 months, he started cutting down his medication. And within 3 to 4, 5 weeks, just in a conversation with him on the telephone, I could guess, yes, something is going wrong. So immediately went across, got him back to Chennai, and we readmitted him into the hospital. Here again, then this time was a slightly longer duration. You see, what I realized is every relapse leads to a longer recovery phase, a larger dosage for a longer period, and as somebody said, disability factor was more perceptible. This is what was very clear. Anyway, this time we realized that he should not be left alone. We should be with him always. Caretaking is as important as his medicines. And that's when we started monitoring, we started giving him medicine. But here again, let me one aspect as an affected, as a caretaker. What happened is, after a period of about 6 months, when his medicine levels were good, he was feeling good, he started meeting psychiatrists on his own. 2 sessions, 3 sessions, 4 sessions with them, and he will then tell them, look, this level of medication, why don't you reduce it? And believe you me, 2 psychiatrists reduced the medicines. He was re-hospitalized. And in both instances, we rushed to the psychiatrist and told them, look, this is regularly happening. This goes back. He goes back into this, but unfortunately, our system is such that I don't know. I don't know to which authority we should write, but no psychiatrist should reduce any medication without the caretaker's concurrence. I think that should be made mandatory. Because here was this guy who had to undergo, whenever he goes hospitalization, we undergo a trauma. And it was devastating, because every time getting him to a hospital, and he's well grown and he's a big hefty man, and also he's a very sharp guy, so he knows how to beat the system. So this is something which we found as a caretaker, to our chagrin. I wouldn't want to call it irresponsibility, but it is, when a person is on the right medication, he is so near normal. The doctors tend to feel that everything is fine, but it is not so. The dividing line is very thin, indeed very thin, and we have found it with a lot of unhappiness to us and unhappiness to him. That's a fact. Okay, the third and the last phase, what we did, we said, now this is something which we have to live with, we have to give help, and in order to avail of the excellent rehab facilities that we get at Carabams, the psychiatric help, the counseling help, we decided to, relocate to Bangalore. So we as a family, just the 3 of us, we shut shop of Chennai, relocated to Bangalore. We continue to stay here, continue to have periodic visits to the psychiatrist, to Carabams. And we are now in a process where we are trying to get him to do something useful. He is very well qualified. Therefore, he wouldn't accept anything that is lower than what he thinks is his level. But then we are trying to convince him and put him into something where he gets occupied, his social skills improve. And looking forward, what are our worries? Who would take care of him after us? Is there any long term? And short term, we need also, the stress levels are high, no question about it. In fact, I quit to myself, to my wife, I say, that perhaps we suffer more than him, because maybe he is in a state of, oh, okay, it may be unreal world, but maybe he is happy in that world. But the stress levels in us are enormous. And therefore, is there something where we could have short-term, caretaking and long-term caretaking? That is one aspect. Other things, is there anything where people like our son can be gainfully employed, giving them an improvement in social skills, because these are highly well qualified guys. These are like the person who spoke some time ago. Like he's a shippy, so his way of looking at jobs, his way of looking at life is different. Similarly, these qualified guys, they look at things differently. Are there nodal organizations, or are there organizations which would encourage? Because that would go a long way in helping him and perhaps helping ourselves as well. Thank you all for giving me a patient hearing about a patient. Is there anything else you would like to know? Please feel free.